Welcome, welcome to our Nurses Week celebration at powerupnursing.com. We are live on LinkedIn and Facebook, and we are waiting for some registered people to join us. But I wanted to ask if you're watching this and it is live to please, please, please just keep here and you can send comments. And that would be great. I should probably open up my other computer so that I can see LinkedIn simultaneously. Oh, I see that there are already 8 people on. That's great. Yay. If you're on and you can post something in the chat. Good. Okay. Hello, Monique Andrews. Good to see you. I am going. It's hard for me to address both the comments and the banners because I'm going to need to do both. But it's a test of talent. How about that? Online talent. Happy Nurses Week is the banner. And I will go back to comments. Oh, yes, quite a few people joining us. It's good, 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 good. Hi, Kimberly, Layla, Monique. It's nice and on time. I love it when people are on time. It's only 1 minute after 4. Hi, Angel. I'm going to oh no, somebody has had a client emergency and hope everything goes well. I'm trying to figure out um, how I get you, I can have you guys all on the screen at the same time. So what I'm trying to do is invite you. I'm going to invite you to the studios. Um, I just don't know who. Hi, Angel. You're being invited, and we will hopefully get our nurses on and then invite others. Good. Excellent. Excellent. I can bring you on as you come in. All right. So I'm going to start bringing a few people on as you come to the stage. And so far, Kimberly, you're the only one that's figured it out. So take yourself off of mute. Hey, happy
Hi,
Nurses Week.
everybody.
We have
Happy
6
Nurses
We
Week,
have a lot of
everyone.
people watching. Hi, everybody. I know that
Um,
you're both on Facebook and on LinkedIn. And if you can identify yourself, and if you put your name in the chat, I can invite you to the stage to be with us. So it's so good to see you, Kimberly. Introduce yourself. I know you, but the world does not.
Sure. Well, thank you so much, Tanya, for having this here today, this opportunity for us to engage in some provocative discussion and just celebration of this wonderful thing we call Nurses Week, which we know every day is a day for the nurse to serve and to be a bright light, beacon of hope in their communities. So my name is Kimberly Delbo. I've been a nurse for 18 years, serving in various positions across the care continuum from bedside to boardroom. I have a passion for nursing in general, but also healthcare transformation. So I'm really excited for the future of healthcare and what this means to transforming the systems in which we work and the communities in which we live. So I'm thrilled to be able to be here with you all.
Trouble 1 and 2, that can't be right.
I'm encountering problems. Techers are all coming into the room.
Yeah, everybody's coming in, and I just got to make sure that I invite people to come in. This is also recorded, so I'm able to put this in and onwards. The whole idea is just to get together, chat, give a couple of prizes away. I don't know you, Angel Hoffman. Who are you? Where are you from in our country? And happy Nurses Week.
Happy Nurses Week. I am, as a patient told me once, I'm not an old nurse, I'm a seasoned nurse, but I've been a nurse for 45 years. And
wow.
Yeah, cool.
And I just kind of sort of retired in August, and then I didn't really. I just kind of been involved in committees and things, and national and international, things like that. So I'm actually still out there doing stuff. So I don't think I can actually just say, okay, that's it, you know. But anyway, I'm from
Great. Well, you found
Pittsburgh,
us. Are you-
Pennsylvania. That's where I'm from.
Oh,
Yeah.
wonderful.
So is Kimberly, correct?
Yeah, I'm from Pennsylvania as well. We should
Okay.
connect
Where
on
are you
LinkedIn. I
from?
don't
What
know if
part?
we're
What part
So
are you
you-
from? Angel.
Oh, I'm from Pittsburgh, Pennsylvania.
Oh, so am I.
Oh,
Oh my God. I cut my teeth at the University of Pittsburgh Medical Center. I was in executive leadership at McGee Women's Hospital.
oh
So,
my
oh my
gosh.
God, yay, it's a Pittsburgh thing.
Yeah.
I have Carol coming on too. All right. So I'm going to start with and oh, wait, Monique, I know you're excited to be here. You have an incredible story, incredible perspective on the future of healthcare. Introduce yourself.
Thanks so much. My name is Monique Andrews, and I'm excited to be here today. And I'm not a nurse, but I do appreciate you for I think, hardest working people in healthcare are nurses, and what a true blessing that you are. And, Tanya invited me here today just to talk a little bit about COPE, which is inclusive and affordable therapeutic platform that I have. I'm not here to sell you anything today. I just want to tell you about it. It's really an evidence-based platform with practices to boost resilience. Tanya and I have been talking a lot about how we might be able to support. So I'm just excited to be on here today and to see how I might be able to support you in any way that I can.
Okay. And what is your website? It's www.cope, right?
It's letscope.org. Pretty simple.
Oh.
Letscope.org.
I love it.
Well, thank you. I'm going to put that up for everybody to write down, because pretty soon we're going to have our first prize. So we have a lot of people that aren't identifying themselves, because I see them in the viewership on LinkedIn and things. But hey, if you want to be identified, if you want to come on, please just identify yourself. So in the meantime, I want to ask our most experienced nurse, because Leanne is amazing. She is Power Up Nursing, if you don't know, is a national organization that has a virtual platform, but we also meet twice a year. Our national, that's who was Rosa Hart. She has a patient emergency. Our national meeting, our national convention this year is October 14th through 15th at Norton Healthcare in Louisville, Kentucky. It's going to be exciting, right downtown in Louisville. And it will be upwards of 125 nurses gathered together with the idea. Our title is Voice and Vitality. And if you're not on our mailing list, go to www.powerupnursing.com and get on there so you learn about it. Retired nurses, there's no such thing. Half of my advisory board
Proof.
So that just doesn't work. It's like you just never retire from nursing. That's a part of the vocation. So I send this out in a very, very huge thank you to the nurses who have brought me to this point in my life that want to establish a nursing program that really changes the vitality of what it means to be a nurse and to serve patients, so that they really and truly have the environment, if you will, to become well and not just treated. So it's a very exciting time, as everyone has said. Oh my goodness, I have comments coming in. I so apologize that I'm not keeping up with them. But I want to say this. I was raised by a nurse, not my mother, but my aunt, who was a nurse from the time she was 18 or 19 until the time she was 70. She was registered to come on. I hope she does get on, or she might be listening. If that's the case, I just want to say, Aunt Margot, you changed my life. Sorry, I don't want to cry, but that's a part of Nursing Week. I just wish hospitals would understand, for the most part, of what Nursing Week actually is. So my question to the most experienced nurse who's on here right now, which is Angel, is what is your most memorable? First of all, how old is Nursing Week? Does anybody know that?
No, I don't.
No? Okay, well,
I know it's as long as, as I can remember, but I
yeah, okay.
don't know.
Well, did you find out? Okay, go ahead, Kimberly, Dr. Delbo. She's academic. Of course she found
Sorry, I
out.
have myself muted. It's October 1954 was the first Nurses Week.
Wow.
So no
Wow.
wonder it's been
We're
my
looking at, would have been, pardon me?
I said no wonder it's been
Years.
as far as I can remember. It was before me. So
Yeah, Nurses Week was
that's
first
so cool.
celebrated in October of 1954 to mark the 100th anniversary of Florence Nightingale's mission.
Oh, wow.
Me.
I'm sorry Leanne's not back on because she knows she's like my Florence Nightingale bioist. What do they call biographer? She's absolutely awesome. Okay, so back to the question. Angel, what is your best memory of a Nurses Week event?
well, let's see. I think it was a time when we worked so well together that it's almost like if you spilled your coffee, I'd pick it up in a cup. Like, you know what I'm saying? Like, so in touch with each other. And we were very young. We were like in our early 20s, and we got along so well. And our quote head nurse, as they called him back then, she was more like a mother to us. And so I think that was probably my first one, and it was great because we felt like we were family. So that's what I recall. Yeah.
Yeah.
And how hard is that these days in the large kind of corporate structures that we're in to feel like family? We're very proud. I want to announce the press release went out last week. Power Up Nursing is now an in-hospital nursing burnout prevention program at the largest public provider network of hospitals in the U.S., and that is Jackson Health in Miami. Thank you for the applause. It's all of you that make this possible. And my gosh, Angel, we need you. We need you in an advisory capacity because you've got the heart and the experience, because our goal is to measure. So our goal is data-driven nurse wellness transformation, not just to sell nurses, be mindful, nurses do yoga. You know, all the nurses I know, they'll go buy the yoga pants, but that's about as far as they get, right? So sorry, but it's true. The issue here is how do we make a burnout prevention, medical error reduction, well-being, excitement platform that actually engages nurses, that it's easy to use, and that we can measure real results that can be replicated at other hospitals. So our goal here is to take it's called Power Up Jackson for Health and Vitality, to take that Power Up Jackson and to go to other hospitals across the country, as I very much did in women's health 15 years ago. So it's very, very excited and timely. So what you just said, Angel, is really powerful, and that is your favorite experience with Nurses Week is when you said, oh my God, this is not just a profession, this is an extension of my family. And that is really powerful. I don't know how many nurses really feel like that. Now, I know my nurses at Jackson that are led by a woman by the name of Dr. Carol Biggs, Dr. Carol Biggs. Her nurses are 4,800 strong. And I have met at least 30 of them, some in leadership, some not. But when Carol walks the halls of every single, I think it's 7 hospitals, and I've been with them through 3, it is like Mama Bear has come. It is not at all fearful. It's, oh my gosh, Dr. Carol's here. Cool. I want to tell you what we did. Our patient census has been up and we have it's amazing. It makes me celebrate nursing, where there's been some institutions, and I worked at my heyday with over 320 of them, where if the nurse executive walked around, there was like a lot of quiet, a lot of, and that doesn't bode like the family, right? It just doesn't. I'm going to give away a prize. Let's see. Now, Matt's supposed to be on here. Matt, if you are on here, please identify yourself, because I know you wanted to talk about your book. And I know that Cheryl, if you're on here, I know you wanted to talk about your book and possibly give one away. So make yourself known and we'll make that happen. But in the meantime, I'm going to give a pretty nice big one away. It is $500 to attend our 2.5-day conference, October 14th and 15th. Early bird will be $400. It will be going up soon. Like I said before, we are hosted by Norton Healthcare, the largest, of course, provider in the state of Kentucky. An amazing healthcare system. They actually used to be a client of mine when I had my women's health program called Spirit of Women. It's going to be an amazing time. Rosa Hart, who is their stroke navigator, an internationally known podcast called Stronger After Stroke, a brilliant young nurse, will help me facilitate the event. I'm going to give away a totally free attendance. You will have to get there and you will have to get a hotel. But other than that, it's a free attendance. So maybe we'll get some of those people jumping so that I can. The problem is I don't think I can see the LinkedIn. Can I ask a question? Any of you, how did you come in? Did you come in through StreamYard, or did you come in through LinkedIn or through Facebook?
StreamYard.
StreamYard?
Yes.
Mhm.
So I cannot see the LinkedIn names, etc. Those of you, we still have another 10, 15, 20 minutes that want to win and want to be a part of this. Do me a favor, go to the original email that you got that has the link to this podcast. So if you're viewing live, which looks like there's 40 some people on LinkedIn, 30 some on Facebook, I can't see you unless you come through that that link. The other way to do it is just scroll up in wherever you're seeing this and find the link. I put it up like 4 or 5 times in the past 2 days. Okay, and I take it, Layla, you came in also through the StreamYard, yes?
Yes. Can you not see me?
Oh, yeah, we can see you.
Oh,
You're
okay.
here. Definitely here. Okay, so we're going to do this. So it's totally free. The easiest way to do this is for me to think of a number between 1 and 20. And the person who gets closest to it without going over gets the prize. So write down your answers in the comments. Tick tock, tick tock. Come on, come on, come on. Okay, Angel gave us an 8. Kimberly gave us a 7. Layla, everybody, Monique. I know you guys can afford to come, but we want you there. We want you to win. Okay. So I think I feel so bad because there's other people watching. Love you guys. I apologize. Try to get on the other way before we give away these really cool shoes. Okay, the number that I have is 13. Monique, you come for free. I'm going to be putting out what hotels. There's going to be some certification programs. It looks very good, like we're going to have a cannabis medicine certification with a medical trainer. We'll be having somatic functional therapy for pain and a few others. The use of therapeutic oils. It's going to be a really amazing experience for nurses. Congratulations, Monique. All right. Well, I asked you, Layla, really quickly to come and tell me how you got on. I'm going to let you just very quickly tell us who you are. Layla's our brand new. We have partners, right? That come with us. They give us some money so that we can have great meetings. We have a great cruise coming up. Some of you were on it, June 15th to June 22nd. I'll put that link up, or maybe Kimberly, you've been so helpful. www.powerupnursingcruise2025.com. It's going to be an amazing event. But so we have partners that help us pull these off and do giveaways and all kinds of great things. And a brand new one is very rare. So for me, it's really important for me to say that we have huge companies that come on. We have like the David Foundation that support us. We have all these other companies, whether it's in kind or cash. Layla is Layla, okay? And she has made a very large cash investment to help nurses find the best healthcare, whether it's marketplace or otherwise, along with life insurance. So her company is called First Family Insurance, and I'll get a banner up or if you can do that, Kimberly, that would be great. First Family Insurance. And Layla, you will give us your phone number and we will make sure that that's also, I can do that on the screen. Layla, how do people best get in touch with you? 804?
The 804 number, yes, ma'am.
804. Can you give me the rest? Because my mind is good, but not that good.
It's 804-248-5819.
24 what?
So 804-248-5819.
5. Got it. Okay, I'm going to put that up right now for us. Add the banner. Okay, so tell us what you do.
So, hi, everybody. Thank you for having me today. I'm enjoying the conversation so far. My name is Layla. So, I am with First Family Insurance. I own a private health insurance agency. We specialize in private health care for travel nurses, 1099s, independent contractors, small business owners. So, for a while, I've been working with travel nurses for about 2 years now. A lot of them are on contract, and when they lose their contract, they don't have insurance and they have to keep going from different contract insurance and so on and so forth. So we come right in the middle between marketplace and company insurance through employers. So essentially we offer a product that's very unique on the market, unlike any that you've seen, where it provides nationwide PPO coverage. That's very beneficial from what I've found, because a lot of nurses, they travel all over the country. They're not just in one state. So they want to have an insurance that travels everywhere they do, that also offers affordable rates. A lot of travel nurses and people in the medical field in general make too much money to qualify for the marketplace, so they find themselves looking at premiums of over $1,400 a month. So that's where we come in to offer, preferred provider, largest network, but also something that goes everywhere they go.
We're losing your sound a little bit, but yeah.
Can you hear me okay so far? Up till now?
Yes. Now it's yes, that's better, Layla.
So
Okay.
we offer insurance that goes everywhere they go, but also gives more affordable rates than that of the marketplace if they don't qualify for a subsidy, if their income's too high, which 9 times out of 10, that's the case with nurses. So I'm very happy to be here. I'm thrilled to be in this partnership. Thank you.
And we are thrilled to have you. And Layla has an amazing promotion, so you don't even have to win it. Those of you, and I'm imagining, Monique, you're in this category, that are entrepreneurs, 1099 people. I am. I'm going to talk to her because it's just ridiculous. I thought that the insurance I was spending $1,500 a month on was actually going to cover a drug that I need or a doctor that I wanted. And they said it did online, and then it didn't. And so I was stuck having to wait. I mean, it was just crazy. So one of the benefits of having Layla on our Power Up Nursing team is that I personally endorse her. I trust her. And if she blows it with somebody, she's going to blow it with everybody. So sorry, no pressure, Layla, but it's very exciting. But the trick is, if you just call this number and just want her to assess, she also does life insurance, which is really, there's different kinds. It's complicated, but it's important, right? If you just want her to assess what you have, she will send you via email a $10, Starbucks little gift certificate. If you don't drink coffee, I bet you she'll do Amazon. It's not a big deal, but we want to get her used to talking to you. So please, if you're listening, oh shoot, there's all kinds of comments. I apologize. If you're listening, what's the name of your company? It's, let me put it up. Well, it is called First Family Insurance. Monique, I don't know if you are subscribed. Are you subscribed to Power Up Nursing? Do so. We just had a release of the announcement of Layla and First Family Insurance. So please give her a call. Marketplace, you can kind of change anytime. Some of the others, you have to wait to open enrollment, but this is the woman to talk to. Retirees, managed care of your Medicare, all these things are tricky, and there are ins and outs and shortcuts. So anyhow, I just want to say thank you, because I know that's a big commitment that you just made to Nurses, Layla. And that's what Nurses Week is all about. Nurses Week is really all about making commitments to nurses that weren't there before. And I mean, you guys have all seen it online, some of the horror stories. Can Kimberly share them with me? I know you know some. What hospitals do, right, to celebrate Nurses Week?
Mhm. Well, we have a lot of stories of what they do. Unfortunately, like Angel, they're not as heartwarming and endearing as what you just shared with us. But there are a lot of good hospitals out there. But we're over the pizza parties, right? We're
I was
over
just going to say
some of the
pizza and freaking donut. I went
yes,
to a huge,
donuts. I mean, how unhealthy, right? I mean,
how unhealthy.
seriously.
I went into a what is that, cardiology practice today, huge cardiology practice. Half of it is, really private and really upscale. And what came in for Nurses Week for those nurses was an atrocity. Donuts, um, what is that called? Popeye's chicken was their lunch today that was sent to them by a patient. I'm like, oh my God. It's crazy.
It is.
And that's if you have time to eat it.
Yeah.
Tanya, can I jump in for a second?
Of course you can, Monique.
I didn't realize you were giving away prizes today. I'd like to throw a couple of prizes in if I can.
I'll do it right now. What are we giving away, Monique?
I want to give away 2 memberships to Let's Cope. So you get 60 days for free, includes the live coaching, access to all the programs, and just use the code. Hang on, got to double check my code here. Biohack60. If you use the code Biohack60. And I'll drop that in the chat. And in fact, anybody who's on the live call today can take advantage of that. You'll get 2 months of our programming for free, includes the live coaching, all of the content and resources. If you're on the call today, you want to use the code Biohack60, go to letscope.org. I have to run because I got a training myself, and she's going to crack the whip if I'm late. So just go to letscope.org. Use the code Biohack60, and you'll see all of the amazing resources that are there.
Thank you, Monique.
So exciting. Well, we just got back from the Power Up Nursing Cruise, and Kimberly and a lot of other wonderful, vital, leading nurses were on it, including Dr. Carol Biggs. And one of the things that came, that was crazy. We attracted nurses that were just on the cruise, right? They were just on the cruise with their families, enjoying themselves. And they said, nurses, and then they joined us. Yeah. It was like this huge embrace of people that wanted to make health easier and better, not just for themselves, but from everyone. Kimberly, you want to give your perspective on that dynamic that happened?
Oh yeah, of course I would love to. So as Tanya said, we're in the elevator, and you could just imagine we run into this gentleman, and he's like, "Oh, what are you guys here for?" And he said, "My wife's a nurse. You have to meet her." So we Rosa Hart and I was with Rosa at the time. We ran followed the gentleman through she was out by the pool. We met this lovely person. She told us her nursing story, her journey, where she's at now in her career. We had another person just kind of saw the Power Up Nursing sign outside of the conference room and just came in with her son. Then she, wanted to be a part of it. And she was so encouraged, to the point where these folks, they were just in tears, right? They were brought to tears by how encouraged they were. They were coming onto the cruise, and they're at a point in their career, some of them, where they felt that they weren't sure if they still wanted to be a nurse or what the future was going to look like for them. The one person, she just said, I left my job. I can't work for that position anymore. And they came in and they left invigorated. Talk about transformation, right? I know it sounds kind of crazy, right? We're just there for a couple short days, but the camaraderie, the resources were real, right?
Yeah,
it wasn't just that whole lip service, right? We hear a lot of lip service during Nurses Week, even, but these folks were providing resources that can be actually used in their day-to-day life to transform and ameliorate their stress levels. We know that That's the root cause of burnout. And that's what we're experiencing now in healthcare, sadly, on many levels, not just nurses, but healthcare workers in general. So this is when we look at the now, right, and then what the future is going to hold, I look at it with this beautiful lens of what lies before us. Because when we
Mhm.
come together, right, as providers and as nurses, and look to transform the system to have it data driven, in terms of our well-being and caring for ourselves, so that
Mhm.
we can indeed care for those that we're called to care for. And the
Yeah, and
reason
if you're
we're all
listening to
entered.
this, if you're listening to a recording of this, you're listening right now to Kimberly Dalbo, Dr. Kimberly Dalbo, who is a professor of nursing at Commonwealth University in Pennsylvania. She is on our advisory board, which is growing and kicking up the projects that we are launching. So again, I have to do my advisory board justice to run through them. The very next thing that you can register for, if you're not at Jackson, you can't experience our work yet. But if you're at a hospital system and you talk to your HR, have them call me. Or have them get in touch at info@powerupnursing.com to find out what Jackson is doing that's potentially relevant to you at your hospital. The first thing, though, that you can individually sign up for soon is the 2024 annual convention, Voice and Vitality, October 14th and 15th at Norton Healthcare Hospital, downtown Louisville, Kentucky. The second thing that you can already sign up for with just a $300 deposit that is totally refundable until April 1st, 2025, is our 2025 nursing cruise. It is amazing. I cannot wait. It's like something I am already looking forward to. I came back younger. I came back stronger. I came back on fire for this project. Next year, it's June 15th through the 22nd. I really hope you're not afraid of boats, Angel, because I'd love for you to be on it. It is going to leave out of Miami, Florida, and we're gone for 8 days, 7 nights. And what's cool, it's Father's Day, so you can bring hubbies, dads, significant others, and kids because it's out of school. And we go to Jamaica, Grand Cayman, Mexico, and the Bahamas. And we will have 3 full days of family and friend time. And the rest we will have, various curriculum and various presentations. And it will be 15 to 25 CEs, and it will be absolutely awesome. So this is www.powerupnursingcruise.com, 2025.com. I'm asking everyone to go ahead and, if you're even suspecting at 50% that you're coming, because we got shut out this year and we couldn't take any more people. We don't want that to happen. And like I said before, it's written down, it's guaranteed. I'll give you that cash back by April 1st, 2025. All right, so now we have a really big prize. We have a partner. Let me put this up. www. They couldn't be on the call today. We have lots of partners that might be on the call, but they can't get on because they're not coming through the right way. And in the future, I'll know this. I'll probably just do Zoom in the future. I use StreamYard for all of our podcasts because it's kind of fun and you can brand it. But I think most people aren't used to the way you access it. So www.vibram.com is right there. They're an amazing shoe company. Now, what is amazing about Vibram shoes? They are not clogs. They are not artificial insteps because they have science that demonstrates something really cool. I didn't believe it because I have a total flat foot and I'm in a lot of pain from it, right? I always believed that I had to have something shoved up under my foot. But what that has done is made my foot pain worse when I'm in the hospital all day or with patients or on my feet or running around a cruise. So instead, it's really Asian and Italian technology where your feet are on the ground and they're shoes that your toes fit through so that your 5 toes are separated, which creates new balance and energy. If you have any feet problem whatsoever and you wear these for a couple weeks, it takes about 4 or 5 days to get used to it. Bunions, hammer toes, all things that I'm familiar with. Start realigning because your body is walking naturally and it has a small instep, a small sole so that your feet are protected. You're not walking barefoot. Then my favorite shoes are these Japanese shoes that cross, right? You slip your foot in and cross Velcro. They're really cute. A doctor I showed them to bought 7 pairs. They're just the most comfortable thing you'll ever wear. So you're going to have your choice of a free shoe. All right. So I'm going to pick another number. And remember the Biohack 60 at www.letscope.com. Remember, please, Layla wants to buy you a cup of coffee and really help you. She's not going to be a hardcore sales pressure person because you'll tell me if that happens. What I want her to be for the next couple of years, if she'll be involved, is our consultant when we have questions about how to protect ourselves and our family. And that's really critical to every nurse that's out there. And your parents, you know, Medicare is getting crazy. These managed care Medicare programs are really hurting elders, are really hurting seniors. I have so many patients. I do chronic care management as my real day job. And I have so many, I'm sorry, I'm getting a package. Happy Nurses Week. Maybe somebody sent us donuts, yay. But I will tell you that honestly, they're not giving seniors anything near what they need. And seniors are doing it because they get an extra $100 a month for groceries. But when something bad happens, they can only be in the hospital 8 days. It's crazy stuff. So Layla can really be a resource for you. And if you have just a question about somebody else's insurance, please give her a call. Now we're going to go back to the Vibram.com and the shoes. And I'm going to pick a number and you guys put it in the what is this called? The chat stream for StreamYard. And I'm going to between 1 and 15. 1 and 15. This is a big prize because these shoes ain't cheap. That's why I only have 2 pair. I have the fingers and I have the wraps and I love them. Okay, people are putting their numbers in. 1 and 15. 1 and 15. 1 and 15. Blah, blah, blah. Blah, blah, blah. Okay. Okay. Good. Let me look down this list. All right. My number was 2. Kimberly Delbo. You're either going to have 5-finger shoes or the wraparound.
They're cool. Super cool. You know, I have to tell you a quick story about shoes on Nurses Week. So in 2020, I was a director of nursing services and innovation in the senior living space at the time. And I thought to myself, what could I get my staff, right? I want to get them something that they're going to use. And they were running all over the place. So we got them shoes. They could pick out any shoe that they wanted. Any shoe. And we let them choose what shoe they wanted. And we covered the cost. And that was their gift for Nurses Week. And, you know, and it just warmed my heart because I saw some of the staff and sometimes their shoes were like literally their soles were like uneven and it just didn't look safe and healthy. So I was just so elated that at the time the leadership supported me in that decision in offering this frontline staff new shoes for Nurses Week.
Yeah,
but we got to walk the walk.
I'm going to make sure Vibram listens to this. They're not on as a partner yet, but that's an idea. Man, that's an idea.
Well, thank you to Vibram. Thank you for the new shoes. I can't wait to try them.
Yeah, I mean, like it's hard for a hospital to buy 4,800 pairs of shoes, but there might be like, you know, the hospital puts $30 towards a pair or $50 towards a pair because, you know, pizza is expensive too. And these little meaningless parties and I'm not disrespecting anything any hospital does because it's something. But I know that when I walked into one hospital, it's not Jackson. I walked in today just briefly because I was dropping off some monitors. I said, Happy Nursing Week to the front office staff in front of the diabetes center. And they went, yeah, happy. That's really sad. That's just
Mm-hmm.
sad. So I believe it's Power Up Nursing's part of our mission is to find innovative programs. So one of the
Mhm.
things that we're talking about offering around our cruise is offering hospital CNOs a package that they can do in January. New nurse. Tell us what you're going to do to be a better, healthier nurse this year. The winning nurse or nurses gets to go on the cruise for free.
Mhm.
We'll announce them in May during Nurses Week, but the nurses will know probably by February or March so that they can get the time off and plan. So we're just trying to make Nursing Week, just like you did, about a nurse's well-being,
Mhm.
about her sense of, I really needed that. I really wanted
Mhm.
shoes. I
So
don't
true.
need donuts. I'm already, overweight. Thank you.
Mhm.
This job
Mhm.
causes that, right?
Yeah.
Too bad Dr. Rodriguez couldn't be on the call today, but she always talks about that. Like,
Mhm.
it's not about how much you eat, it's about how much you stress. And that's
Mhm. Yes.
the problem, right? If the more we
Mhm.
stress, it's not the more we eat, the more we stress, the more our body hangs on to carbs and fats.
Yes.
Because remember, it's about fight or flight. And your
Exactly.
body needs fuel to do that. And the only fuel it knows is carbs, right? So I don't think any of you are fighting and flighting in the hospital. Well, sometimes you are these days with the way things go, that's for sure.
Mhm.
Well, I don't want to take up too much more time because I want people to listen to this. I am so delighted. I look forward to putting this up again. It'll be probably broadcast twice on all of our platforms so that people can meet you guys and understand what you're doing and know about our work. And I'm going to put it up one more time, which is the www.powerupnursing.com. Go on there. All of our events are there. I just expect you to please sign up so you can be a subscriber. We don't inundate mailboxes, maybe once a week, maybe twice if it's fun. But we want you there and we appreciate you. And Kimberly, I so love your face um, in a way that it just so much light to me and to, I think, probably thousands of students and that you care for. Layla, again, thank you from Power Up Nursing, from our advisory board, from our nurses to make the investment to be our advisor. I don't want to say insurance salesperson. That's disgusting, right? I'm insurance sales, right? Nobody wants to talk to an insurance, but an advisor is what I think Layla has presented herself as. And that is so, so cool. This is it. So this, one of the other things, yeah. Okay. So we are at 42 minutes. Didn't want to go over 45 and we haven't. I just want to say happy Nurses Week.
Mhm.
Everyone that is listening to this peripherally and couldn't figure out how to win anything and is cursing my name. But please do me a favor, subscribe if you're not already in our network. And I promise you it will be a prize in and of itself. That's just not marketing talk. We do a lot for our nurse network and to
Mhm.
lead a nurse-led, I want to say revolution. I mean,
Yes.
our CEs are called Renegade, RN again, renegade, right? So we are doing everything we can to do what we feel is best as healthcare providers for ourselves and the patients we serve. I'm going to let
Mhm.
Kimberly, as an active professor of nursing, close it out to talk to nurses and students this Nursing Week 2024. Kimberly,
Oh,
I'm going to let you be all.
wow. Thank you, Tanya. Thank you so much. And I just want to say thank you to all of the nurses out there, from the classroom to the clinics to the community, to the hospitals across the nation, in any role that you are serving or potentially serving those who are on the front lines. And I just want to honor you for what you do by selflessly serving humanity at the core, by pushing the needle forward to ameliorate stress, promoting mental health resources within your networks, and championing programs to support the nurses' well-being and ultimately preventing and mitigating their burnout. we are here for you, helping to provide that data-driven decision-making alongside of you as you function as change makers to build a better healthcare system for tomorrow. Thank you, and I enjoy raising our voices with you unifiedly. Thank you so much, Tanya, for all that you do for the nursing profession and healthcare.